All right, let's get started. Thank you everybody for joining us today on this very exciting webinar opportunity. I'm very honored to be speaking alongside with Laurie Orlov, Ryan Frederick, and Dr. Bill Thomas. And we are going to be talking with you today on how technology is transforming how we live, whether we're trying to live independently at home or in a community. But we'll talk about enabling technology tools and just the way that the experience of aging in place or aging in a community is changing as innovation and technology is furthering the landscape. So first of all, this webinar is brought to you by GrandCare Systems. I am the CEO and a co-founder of GrandCare Systems, and I'm delighted that you could join us today. We are recording this so that you're welcome to email us at sales@grandcare.com. We do have a host that is on. You can see GrandCare Systems on the side, and you're welcome to reach out to Erica or Hans, who are available to answer any questions. All of the speakers are also available to answer any questions after the webinar, and we will be sharing all of their information with you. If you would like to reach out directly to any of them, just reach out to GrandCare Systems on the message, and we'll be happy to give you their contact information or provide them with yours. So thank you so much for joining us today. Without further ado, I'd like to really just kind of introduce who's going to be speaking with us today. Laurie Orlov is our first speaker, and she is such an interesting and engaging person and really just has a big expertise in the aging in place market. She's a thought leader. She reports on market trends, blogs, reports. Her website, ageinplacetech.com, has a lot of articles and guidance about technologies and services that enable boomers and seniors to remain longer in their home of choice. So she's going to be our first speaker, followed by Ryan Frederick, who is also an industry thought leader. He's the CEO at SmartLiving 360. He's a consultant, developer, keynote speaker in the intersection of healthy aging in place. And followed by Dr. Bill Thomas, who is the founder and chairman at Minka. He was also a founder of the Eden Alternative, and he's just really, he also authored a number of books. He was the founder of the Greenhouse Project, and kind of a rock star in this space, has been on the Changing Aging Initiative. So that's our lineup of speakers, and then I will be speaking at the end. And again, I'm Laura Mitchell, CEO of GrandCare Systems and principal at Laura Mitchell Consulting. So without further ado, let's go to Ryan. Ryan, are you there? And let's skip forward to Ryan, and then we'll go to Laurie.
Thanks, Laura.
Yep, no problem.
Okay. Well, thank you for having me. I'm excited to be here with everyone else as well. It's such an important topic. And I really see the angle that I come at it, like Laura described, is more how can housing be a platform for our health, particularly in the context of just living longer lives. Next slide. So the three things I want to cover, one is why place matters, I think perhaps more profoundly than many of us realize, and what are these evolving models of living? I know Dr. Thomas will expound on at least one of those later on. And then also just my perspective, having been in the field for 15 years, around what are some of the best practices for technology adoption and implementation. Next slide. A lot of my focus and the focus of SmartLiving 360 is on this intersection of healthy aging in place. And I got to be careful how I say it, because I don't necessarily mean aging in place. I mean the role of healthy aging and how it's complemented with that overlap of place. And what way can our place, whether it's the metro market we live in, our neighborhood, our specific built environment, in what ways can it nudge us? Can it help us live longer, more fulfilling lives? Really expanding that health, not just lifespan, but health span. Next slide. And that comes in a few different ways. Today I work with a number of different groups on the strategy consulting side, working with CEOs, executive teams, boards, in the investor community, so a number of the largest investment firms in the world, major health systems that are looking to keep people healthy and outside of institutions, a number of just large companies that have some capacity or play in the marketplace, and then quite a number of senior housing groups today that are in this space and want to find ways to be more relevant as things develop. And then on the real estate side, also on the development side, and have pioneered some models, one in particular, which we'll get into in regards to what can we do to create more intergenerational environments, allow people to age and thrive in perhaps lower cost settings, but also as an alternative to our traditional senior housing model. And then, like Laura alluded to, do a fair amount of speaking and writing, and perhaps inspired by Dr. Thomas, I'm working on my first book, which will come out next year. Next slide, please. So we're going to focus for a moment on why place matters. Next slide. Next slide. So one thing that back one. One of the things that we sometimes forget about is all of us, I think, get influenced by ageism in our society. It's just so prevalent. And there's this, I think, implicit understanding that the older we get, like, the worse our life is, and the worse we perceive our overall happiness and our self-reported well-being. But the fact is, it's just the opposite. That based on global research found, not just a U.S. phenomenon, but really found throughout the country, that there's this curve. The curve looks a little bit different depending on which country, but the general curve is all the same, which is you're at a certain happiness level in your early 20s, and then you're on this downward slope for a number of years, and then it picks up. And in fact, when you get to your 70s and 80s, your self-reported well-being is the highest it's ever been. It's higher than it was, in your 20s. And so there's a really good story here that's often not told, but also is influenced by what lifestyle and the different decisions we make. Next slide. So one of the foundational pieces to this, in terms of, big picture again, is that our genes are important, no doubt, but particularly as we age, and we're kind of 50 and older, a number of those conditions that might have been wired into our DNA, some of those things would have already happened, and it becomes more about lifestyle. What are these ways in which we live our lives that then influences ultimately our health span? Next slide. And as one example, Gallup Healthways, they have a well-being index, and they break it into 5 different areas. They break it into purpose, physical well-being, financial well-being, engagement in your community, and social connection. And there's more and more research, it seems, by the day that talks about how each of these different areas have an influence in our health span. And there's a lot of talk about purpose being important to millennials. Well, purpose is important at any age. In fact, the challenge is perhaps greater as we get older because some of the social constructs around jobs and raising a family, they change. And understanding how we can have purpose that really drives gives us meaning in our lives is really critical, for example. But so is being physically active in a number of different ways, and of course with all that is written today about the growing sense of loneliness, social connection is so key. And given longer lives, financial well-being and having the plan for a longer life and having that sense of security is also critical as well. Next slide. And today, what we primarily give ourselves in the field is really 2 options. There's more coming, but generally speaking, today we have single-family homes in the suburbs for most people, and where's that risk of social isolation. Then we have the traditional senior living product, which can be very good in a number of contexts, but not done well can also introduce the risk of institutional isolation. And as we think about it, especially with the boomers now in their early 70s, and the psychographics, the way they think, and the sheer numbers and the diversity of that population, we're going to need a lot more models for people to choose from based on personal preference, but also probably from a financial perspective. Where are there models that can hit different price points that make it more attainable for a larger part of the population? And in so doing, how can we use that place, including with technology, to basically help people live longer, fulfilling lives, expand that sense of health span? Next slide. So I think we're in a very interesting stage today because I believe we're in this evolving models of living, not just for an older demographic, but I think frankly for our society in general today. And although I think it's particularly of note right now for housing models for those that are older. Next slide. So part of the developments I've been part of is how can we take existing multifamily, just apartment buildings, and what can we do to modify them to make them more amenable, attractive, and successful in attracting older people, but also just making them truly intergenerational. In some ways, this dovetails or is really part of this broader age-friendly movement that the World Health Organization as well as AARP have been shepherding here in the U.S., which I think has over 400 or so communities and cities now signed on to create and then develop specific action plans around that. In this case, we developed an apartment building in a walkable mixed-use area outside D.C. in the market of Rockville with a public retail REIT. Mostly 2 and 3 bedrooms, have people of all ages, 90s, 80s, 70s, 60s, 50s, 40s, millennials, families there. Different designs to make the bathrooms more, for example, safer for people, so slip-resistant tiles blocking behind the walls for grab bars, a number of things, all of which actually look quite contemporary. You would have no idea that there was thoughtful design necessarily for multiple life stages, but it makes a big difference when we think about the risks of falls, the fiber into the building for basically technology that's embedded in the building, both in the unit and then in some of the common spaces. And then a key piece is some larger common spaces to develop that sense of community. And then we have a role we call lifestyle ambassador that helps create this subtle sense of community that's in part driven by events through the community, but also just, I'd say more importantly, is by residents themselves. Just making it easier to catalyze people to create that sense of neighborhood and connectedness that is so important for all of us. So I think you'll see more things like this where they aren't necessarily a quote-unquote senior living building, but it makes it better for people also at a lower price point. Something like this is at least half the cost of traditional rental independent living. Next slide. You're seeing more models around community living, things like co-living and co-housing. Some of these models aren't necessarily new. They've been around for a while. Co-living is newer. Co-housing is not as new. But you're seeing more talk about it, more traction. How can we create these environments that allow people to just make it easier to connect and at the same time also have it be at a lower price point? So it can allow a wider range of people afford it, as well as support the notion that people may be living to 100, longer lives. So how are we smarter about taking our dollar and our finances longer? Co-housing, where there is a greater sense of ownership and responsibility, quite literally in these communities where there is more shared responsibilities, meals they spend together, ways of cleaning and other pieces that allow in the normal course of life a greater sense of community and independence that allows people to successfully really live in community. Next slide. And then you're seeing smaller spaces. How can smaller spaces be done in new and clever ways to effectively either allow you to live in more expensive areas with a smaller footprint, or just in general make smaller spaces work in a greater way. So you're seeing these micro apartments in downtown areas or some suburban areas, and you're of course seeing the tiny house movement and the ability to create real livable spaces, but in a smaller footprint. And I think we'll hear some of that shortly here with Dr. Thomas as well. Next slide. And then I've been interested to see even manufactured mobile homes have become, they've come a long way from the past that some of us often think about, and where they're quite attractive, they're at an attractive price point. They can be part of communities where you do get that sense of community, but you also have a private space. Technology can be wired in. There's certain pieces you can do or in universal design. I anticipate that you'll see more, perhaps under a different name, but more of these manufactured mobile home communities at a price point and design that becomes more palatable to a larger audience than it has been historically. Next slide. So I want to just close with a couple words on technology. Next slide. So the big picture in all this is we just spend a ton of money on healthcare today. So approaching 20% of GDP, $3 trillion, it is an enormous amount. It's a national security risk, quite frankly, to have so much of our dollars spent in the healthcare system. We need to find a way to do it better and cheaper. Next slide. And part of the tragedy of it, and this is a very complex situation, but we spend more and we get less. So relative to other industrialized countries, you can see we're an outlier there to the right. Outlier not in a good way, where our spending per capita is quite high, but our life expectancy does not fit on the curve that we find for these other countries. Again, we're paying more and getting less. Next slide. And so technology is going to have a key role in all this, and it's going to have a say in really bending that healthcare cost curve and keeping people healthy and out of higher cost settings. In the work that I've done with various health systems, Johns Hopkins and others, this is a key thing. How can we keep people out of institutions, out of skilled nursing, and really healthy in the community and not utilizing emergency departments as heavily as we have in the past. And so a lot of that, though, is pushing more out into the community. And it means that we're going to have to leverage existing workflows and create some new ones around the realities of where people currently live. So if you live in your home, or a single family, what are the realities of that environment? If you live in a senior living community, what are the realities of that environment? These new models, how can technology work in such a way that it truly works? It doesn't hold people back or have unrealistic expectations. And the last thing I'd like to say around this is that we need to see people as people and not patients. Going back to the comment around lifestyle and these key elements, sure, there may be healthcare needs, but at any point, at every point, we need to have that sense of purpose. We need to have that sense of social connection. We need to find ways to be physically active, and technology should help assist in that, be that nudge. It shouldn't necessarily look at too narrow a view of the person. Next slide. So just in closing, my contact information is here. Happy to connect with any of you. There's a monthly consumer blog that I write and publish really on this intersection of place and healthy aging. You're welcome to take a look at it on the website. So thank you. That's all I'd like to share.
Okay, so with that, I think we're going to head right over to Laurie Orlov. Is Laurie unmuted?
Okay, this is Laurie. Can you hear me?
Oh, yay! Hooray!
Yay!
Technology.
There I am. Okay, wonderful.
All right, we're going to start again. So, yep, go ahead.
Okay, so this is Laurie Orlov. I'm an industry analyst in technology for older adults. And this topic today is voice, health, and well-being. I'll give you a little background on myself. In the tech industry, I spent a long time, so long that some people actually refer to me as a grizzled member of the tech industry. And I've been in this space now. This is my 11th year in technology for older adults. Back in the day, my career was in covering IT and IT strategy, and And then e-commerce, and then one of the most exciting technologies I discovered during that period was the web and the transformation that the web had on access to information really for all people. The next disruption really was wearables. I think that's been a really big deal, and we haven't yet seen the full realization of the opportunity with wearables. And finally, I think the biggest disruption is the introduction of voice-first technology, which is what I'm going to talk about today. And the reason I think it's the biggest disruption is really for older adults. It's the biggest disruption because it means they don't have to type, swipe, pinch, or zoom in order to get around and get access to information. They can just use the technology that's most available to them, which is their voice. And I published a report in 2018 that was called The Future of Voice-First Technology in Older Adults. And I'll be speaking more about that in the next few slides. So let's go to the next slide. So this slide is really all about what I consider to be the technology market for older adults. It consists of a fragmented set of individual technologies, although today there are many more partnerships between technology companies than there were when I started in this. There are many small firms in this space. There's a migration going on to more software than specifically just hardware. And nearly every item on this screen has or will have soon a voice interface. And it is increasingly making its way into, voice is making its way into the health enterprises. I did publish a report recently called Voice, Health, and Wellbeing 2020, which is about the use of voice technology for hospital systems and healthcare providers, and even, in fact, getting your prescription filled from a pharmacist. So I just want to mention a few things about this slide. So if you look at the top left, it's all about the communication technologies, and you'll see that in addition to the ones we all know and love, email chat, video, virtual reality, which is fairly new, cell phones, smartphones, tablets, etc., we now have smart speakers and voice assistants. Then if you look over to the right side of this picture, you can see that we have a series of safety and security technologies. And again, we have now the ability to ask a personal emergency response system for help with our voice, in addition to having web cameras, fall detection, and home and activity monitoring. If you go to the bottom left, these are the technologies and access methods we're using now to help older people learn new skills, to leave information, a legacy of information to their children, to volunteer and stay an active participant in society, to find jobs, and we know that more than 20% of the 65-plus population is working today, and also to maintain their financial wellness through a category that was introduced in recent years called FinTech. If you go to the bottom right, these are all the health-related technologies that are increasingly important to us, including mobile health applications on smartphones, telehealth, which is getting sort of a new lease on life due to reimbursements from Medicare and Medicare Advantage, medication management, disease management, the fitness tracker, which is also on the watch, and voice assistants. And all of these technologies are making their way increasingly into health enterprises, but most interestingly, voice technology is doing it. The doctor is interested in dictating their notes. The consumer is interested in getting possibly advice, but at least finding a local walk-in clinic or a doctor in their area. And we're going to see a lot more in this space. So if we go to the next slide. So looking at this slide, we have a number of voice-enabled technologies. The upper left-hand corner is the least expensive. It's the Amazon Dot, around $20, I think, these days, and in fact is being rolled out by the ARP Foundation through the ARPs around the United States to low-income older adults as a way of mitigating social isolation. So that's an interesting change that's happened. In the middle is the Google Home device for use in the home. Below it is the Echo Show, which is particularly cool because it has the ability, as you talk, to display what you've said in large font and also display the answer to the question you may have asked in large font. If you go to the right of that, you can see this fairly new technology that has been launched at CES. It's called Electronic Caregiver, and the person is Addison Care. And this is a tablet-based application that enables people to get caregiving suggestions and advice as opposed to necessarily speaking to a professional caregiver. We know there's a shortage of caregivers these days, and so that's an interesting introduction. Bottom right is Apple Health, the ability to monitor our health and well-being, which last year added fall detection into the capability, and the ability, if you have fallen, to contact whoever has been set up as a responder or 911. You have to enable who the responder is. It could be a call center or it could be a person. Bottom in the middle is Google Assistant, which for people with smartphones is going to turn out to be one of the more useful things because you can ask it almost anything, and you can actually ask it in multiple languages and get an answer. As time wears on, one of the beautiful things about voice is we don't have to do an upgrade on our device or our software in order to get latest features, which include them figuring out phrases that you may have said that they didn't initially understand, and then they learn about them, and then next time they understand them. Bottom left is an entry into the home automation world with a low-cost home automation with smart plugs, which enables us to turn on lights through another interface. We can do that, turn on lights, turn off the lights, raise the temperature, and things like that. Smart plugs are going to be very useful. We can actually connect lots of things to them besides lamps and help ourselves so we don't fall down in the middle of the night and trip over something. Go to the next slide. So this is a slide about how different generations use voice, and you can see that the usage of voice is more cautious among the 55-plus population. They have concerns about data that devices are collecting, and since many people have expressed those concerns, it is now feasible to delete what you've said today. And of course, it's feasible to turn off the device so it stops listening to you. Many people, when this is described to them in the older age ranges, express concerns about privacy. However, that's something they weigh against the utility, which is the ability to search by voice, ask questions, find a restaurant, find a solution to a problem, find an answer to a question they've been wondering about. And if people watch their grandkids and their kids do this, they see that kids are completely comfortable with this. They'll ask anything. Some kids are doing their homework with voice technology. But older adults are a little cautious about using it to communicate with others at this point. I think this is going to change as people become more confident. And again, it's really all about a trade-off. We've been for years trading off a certain amount of our privacy by using, for example, Gmail, which saves who we are and may show us advertising or sell our information might be sold to other people. I think that's a great example of the fact that we have already opted in to sharing information about ourselves, and as voice becomes more accepted, we will opt into that as well. So if you go to the next slide. So it's important to think about the fact that interactions with voice assistants, it's going to vary based on trust. That is, who are you getting the voice interaction, who are you having it with? So low trust interactions could be like, I'm going to set a timer, I'm going to play some music, I'm going to ask a question. Those are low trust requirements for the use of voice technology. Engaging is a little bit more complex because now it requires a little bit of personalization. So it's my music, not just any music, my schedule and my services that I may have enabled. Interaction is, again, another step along the trust continuum, and that may involve conversations, requesting help, and getting information and advice, for example, discharge instructions when we leave the hospital from a trusted source. The next one is medication management. Oh, actually, that's where I put discharge instructions. You can now, with at least one prescription provider, you can now request a refill. You can get a medication reminder at a certain time of day to take your medication and so forth. In the last category, which is really very limited right now with voice technology, you may have enough personal information that you've shared with a trusted source that you may get assistance in managing a chronic condition or having a telehealth monitoring process initiated, or doing a lot more things that are specific to you versus to multiple people. So if we go to the next slide. Oh, the next slide. So I've published 2 reports on this topic in the past 2 years. One of them is the future of voice-first technology in older adults. The second one is voice health and well-being. And there will be more about this in an upcoming market overview that I'm publishing in March, which is the market overview about technology for older adults. That will include voice technologies, but also include the other categories that I described early on. So this is my contact information, and you're welcome to reach out and send me an email to learn more, or check that website and look at all the material there. It's all available on that site for free, and much of the material actually isn't even my material. It's trend information from other sources. So I invite you to take a look, and I'd be happy to hear from you. Thank you very much.
Thank you so much, Laurie. And again, we do have these slides and the recording available. If anybody's interested, you can reach out to any of the speakers or reach out to sales@grandcare.com. Our next speaker is Dr. Bill Thomas, and I'm going to just make sure that we've got him unmuted and ready to go. Are you there, Dr. Bill?
Yeah, I've been enjoying this very much.
Thank you. We're honored to have you here. So without further ado, I'm going to let you tell us about challenging traditional tools for living.
Well, first off, what a delight for me to get to attend this webinar. I'm very excited. I've been learning a lot so far. And I'm really honored I have an opportunity to maybe synthesize some of what I've been hearing. And I thought what I'd do is offer up the framework I use to think about these issues, how I put them together in my own mind, and if any of that is useful to anyone listening, I say hurrah. So the first thing I would say is I frame almost all the thinking I do in this area around the concept of independence. And some people have pushed back on me a little bit on that, stating, I think correctly, that the real issue is interdependence, and I totally agree with that, and that reciprocity is actually the key to human community and well-being. But I choose to focus on independence because that's where people are. I practiced for many, many years as a geriatrician, and I never had anyone come to talk to me about interdependence, but everyone wanted to talk about their independence. So I've really chosen to sort of embrace an idea of independence that's defined this way: being able to choose the place and manner in which you live your life. And I think for most people, living life in relationship with other people is a pretty important part of being independent. And the key driver isn't, and Ryan was really great on this, I thought, isn't exactly where you live, it's being able to choose where you live. And it isn't exactly how you live, it's being able to choose how you live. So I frame independence as the ability to choose the place and manner in which one lives one's life. So now if I take that and then I start to ask questions about, well, how are we going to do that? The second layer for me is a constant dance between architecture, technology, and culture. And I honestly believe that the experience of aging throughout human history on every continent and every age has involved this complex dance between how we live, the kind of dwellings we make, the tools that are available to us, and what our culture says about is a good way of living for older people. And those answers have varied stupendously around the world and through history, but the lens is the same. So if I want to think about pre-contact Aboriginal societies in Australia, there's a very clear pathway for thinking about architecture, technology, and culture as that was applied for those people living for 7,000 years in Australia pre-contact. So those are the knobs on the machine, and you can dial technology, you can dial architecture, you can dial culture, you can twiddle those dials and make a myriad of combinations that result in people living where and how they wish. There's no one answer. Never was, never will be one answer. And then the last concept I'd like to introduce that is extremely powerful for me is the concept, which I know some people are already well acquainted with, but the concept of environmental press. So to summarize some really, really beautiful work, there's an understanding of human capability that says we function at the highest level, and we, in essence, get the most out of life, and we're the healthiest when the stress our environment places on us is not too high and not too low. So environmental press is really the story of Goldilocks stress. Just right. And that's kind of an important, for me, it's a really important element of thinking about technology and about architecture and about culture. We want to build solutions that provide the right amount of stress for people as they age at the right time, and where we can actually modify and adapt the amount of stress in their lives, and they can modify and adapt the amount of stress in their lives so that they can function at the highest level. Now, for people not necessarily familiar with the concept, I'll give a quick illustration. If you ever see a film of an astronaut who's been in the space station for a long time, kind of returning to Earth, the first time you see the astronaut coming out, they're in a wheelchair. The reason they're in a wheelchair is because they've been in zero gravity for like a year. And the body, not being stressed by gravity, loses bone density, loses muscle mass. It's actually pretty complicated space medicine to get their strength back when they come back to Earth. So sometimes people have said to me, wouldn't it be great if you could surround older people with like a mechanical suit that would do all the moving for them? And my answer, I think you could guess, is no, that would not be great, because that very low press circumstance would cause older people to very quickly lose muscle mass and function. Too much environmental press is also bad. And if you've ever been stuck on an airplane on the tarmac in Dallas in August, you can see high environmental press. People kind of sweating and getting uncomfortable and irritable. And when we are in situations where our environment is overpressing us, we lose function. We don't function as well. All right, so here we go. Independence, living life where and how you wish. Tools, architecture, technology, culture. Goal, optimize environmental press for the most people, the most time, and do so skillfully and in partnership with people. Now, I'm just telling you, when I turn my attention to this area, those are the mental frameworks I use, and those are the tools and concepts that I employ. Now, let's jump to Las Vegas, Nevada. A few months ago, like other people on this call, I was at the Consumer Electronics Show in Las Vegas. Wow is all I can say. It's kind of mind-blowing. what you see there. And I spent actually most of my time in the home automation, smart home, healthcare sectors of the show. And I'll tell you what I found. What I found there were many, many point solutions to particular problems and no systematic approach to matching technology to the needs and circumstances of people, older people in everyday life. And I won't name any names because a lot of people are working hard trying to make things better and they don't need me poking fun at them. But there was one company, a mattress company, that had come up with a mattress cover that had an app, and the app would send you notifications about your sleep. And I was interested in this, so I went to the display, and they had very knowledgeable people there, and I asked this question: does your app lead to improved outcomes for the people who use it? The answer? We don't know. In other words, these fine people had developed a piece of technology that did what a nice piece of technology does, which is gather information, transmit information, but they had no idea whether their technology actually made life better for people. And I think if you look at many of the offerings in place today, you'll see that many of them don't actually have any clear evidence that their use improves outcomes. So I'm always in favor of, and I support systems that integrate different elements so that they work together, so that they can optimize environmental press, so that people can function at their highest level possible, so that they can live to the greatest degree possible a life where they wish to live it and on their own terms. That's the way that I think about this. Now, I have just a few minutes left. I'm just going to talk a little bit about a project I'm doing that is attempting to work through some of these issues. Past few years, I've been in a garage playing with robots, teaching robots how to print small houses for older people. And the name of the company that we started is Minka, M-I-N-K-A. And if you want to read about it, you can go to myminka, M-Y-M-I-N-K-A.com. So, point is, geriatrician designed house with a sophisticated technology system embedded in the architecture designed to foster well-being, enhance function, and prolong and protect independence. That's the idea. So we think, and I'm again echoing back to the great comments made earlier, we think really the most powerful technology you can possibly come up with is community. Community is a super powerful cultural tool. And we see Minkas as part of small clustered villages, picking up on some of the kind of co-housing, co-living ideas that Ryan was talking about. We see them using the best technology that can work with other technology. In other words, a brilliant single point solution, not very interesting to us. A system designed to integrate other tools into a whole that's greater than the sum of its parts, that's very interesting to us. A clustered approach to building so that people can be good neighbors and have good neighbors and enhance their access to social capital, that's very interesting to us. So those are my the comments that I was most interested in making, and I encourage everyone on the call to really spend time thinking about your approach to these questions. I've sort of laid out how I do it, but think about what you think the technology is for. Who controls it? Does it really enhance well-being? Does it improve or degrade how close we are to optimal environmental press? Think about those things from your point of view. And last point I would make, which is really super important to me, last point is, it's not just the digital technology, it's not just the architecture, and it's not just the culture. It's a triple alloy that can be combined and recombined in not hundreds, but tens of thousands of different ways to create many different possibilities for different kinds of people with different expectations living in different places. And that's all I had to say.
Thank you so much, Dr. Bill Thomas. Thank you so much to Laurie Orlov. Thank you so much to Ryan Frederick. Okay, great. So let's go to the next slide. All right, so just a little bit of information about what we are. We've been around for about 15 years, and we've been on the market for a very long time. And so we've seen a lot in the industry from implementation, and part of the issue has been trying to figure out how to successfully implement technology. We know the technology works, but the difficulty is trying to successfully implement it into a caregiving situation. So who pays for it, who uses it, how is it used? And that is the struggle that we have had. It's all been more of a process struggle rather than anything else. So there have been many statistics that show us that people want to stay independent at home for longer. So AARP studies show that seniors fear nursing homes more than death. There's obviously a shortage of caregiving staff. The market itself is a huge industry, and there have been a lot of ways that caregiving, it's shown that technology is the answer to mitigating the problems of caring for so many people. We've got 10,000 boomers signing up for Medicare every day, and this will continue on for 10 years. So we can see that technology-enabled care is going to be a way, and that it's not if, the question is how. So let's go through the cost comparison. We've got a rising cost, or we've got rising cost of healthcare. This makes a lot of sense because we have a rising exponential aging population. So let's pretend it's $1,000 a day, which might be an average cost of one emergency room visit, let's say for chest pain. Obviously, that is not a good solution in the long term. If you're a frequent flyer to the hospital, that is not a good solution, and we would simply bankrupt America if we continue to do that. The average cost of a private room in skilled nursing could be $948 a day, and again, these are just averages from various sources such as Genworth and Pew. Average cost of a 24-hour in-home caregiver, now those vary, but between $200 and $250 a day. So clearly, these types of services need to be applied, but they can't be only about people. We've got to use some sort of technology vehicles in order to empower and engage these existing caregivers so that it amplifies what they provide and allows them to care for more folks at once. So why technology? So we've sort of already been through this. We're going from man-on-man caregiving to zone caregiving, right? We have fewer caregivers than we need. There's a problem with caregiver burnout. We have a lack of caregivers and nursing staff. We have a rising population of seniors. We have in the disability market, and of course, all of them want to stay home and stay independent. Why else technology? Not only is there not enough caregivers and seniors want to stay home, but it also is a new revenue source and marketing differentiation. Seniors are now entering into communities or staying home, and they're expecting services to be brought to them. They want to be connected to other folks. They don't want to be isolated, and they don't want to be just sort of put away into a community and be separated from the rest of the world. So who benefits from these types of technologies? Well, we've got the aging population, of course. We've got a large disability population, whether it's developmentally disabled or traumatic brain injury or mobility issues. There's a very large disability population, and of course, that population is aging as well. So there's a lot of overlap between aging and disability. The difference between the aging population and the developmentally disabled population is that in a lot of ways, the aging population is have been independent for so long and then are slowly potentially losing independence. So it's a very difficult time, whereas a developmentally disabled population may have never had as much independence as they've wanted and are finally able to use technology to empower themselves to have more independence. So it's an interesting population, and the different marketplaces can be approached differently dependent on whether they are gaining more independence with the technology or they're feeling like they're losing some independence, which of course this type of technology can empower people to have more independence and be able to manage their own chronic conditions. And of course, families benefit, especially for remote caregivers, where they can now be active in caring for a loved one, even if they don't physically live near the loved one, so they can still participate in caregiving and communication. So what are different monitoring techniques? Well, you know, we've got remote patient monitoring or activity of daily living monitoring. So those are just determining normal patterns. This can indicate if, you know, perhaps incorrect medications are prescribed. There can be a big change in your activity patterns if there is a side effect from medication. We've had so many clients who thought they might be experiencing some sort of sundowners or Alzheimer's, and in fact, when they took a look at the motion patterns and looked at when exactly it occurred, it was because a blood pressure medication had been prescribed, and the side effect was, you know, wandering or agitation or sleepless nights. So there's a lot to be said about our activity of daily living patterns and what is normal, because we're pretty habitual creatures. So what is normal for us? And it's very interesting not only to take a look at the trends of the motion patterns, and of course we're talking motion sensors, door sensors, potentially bed pressure mats, environmental sensors such as the indoor temperature, things like that. And of course, as a caregiver, I may want to know if something seems wrong. If the garage door was left open when it's 20 below wind chill in Wisconsin, or if the front door doesn't open anytime during the day, and of course, if mom has dogs, that's weird. So there are all sorts of different ways that you can customize and know if something seems wrong. And then, of course, digital health monitoring. What is digital health monitoring? Well, it's really just monitoring biometric readings. So it's monitoring your vitals using Bluetooth-enabled devices. A lot of them are off-the-shelf devices, so being able to trend, track, and report this information and identify outliers. Of course, there's also telemedicine, which is really delivering healthcare over phone or video chat. And why are we interested in video over phone? Well, obviously a picture is worth 1,000 words, so we want to be able to see when we're dealing with a loved one or a patient, how does that person look? Are they slurring speech? Is there some sort of aphasia detected? Can we take a look at their face and just see how things are going and complete the picture a little bit and be able to better assess the situation and determine whether they need immediate care or not? So there's a lot of ways that we can sort of identify, not to mention we can set up alert parameters. If someone gains 5 pounds in 2 days, maybe we set them up for a clinical visit and avoid that ER visit, of course, which we know is not only expensive, but also can lead to further risks of infection. Resident engagement is critical. We have to get isolation, of course, is linked to depression and other health issues. But we have to get resident involved. The patient needs to be patient-centered care. They need to be at the centerpiece of everything that's happening, and they should be empowered and know what's happening and have a reason to go back to the centerpiece, which might be a touch screen or a place where they can video chat or see pictures and messages and trivia and the weather. But we have to have something in it for them so that they stay engaged, because that is critical. Patient engagement leads to patient satisfaction, which leads to better health outcomes. So I'm just finishing up here. As far as who is the technology implementation channel providers, well, those could be professional home care providers, disability service providers, senior housing providers, or folks that are already in the home, like telco providers, cable providers, cell phone providers, and then, of course, payers, which are the health insurance providers and healthcare systems. So what do all of these have in common? We're all looking to take care of individuals for less cost, right? We want to take care of people. We want it to provide better care. We want the patient to be engaged in the care. We want family involvement, and we want to save money. Not to mention, there are increased revenue opportunities when caregivers start using technology solutions. Then they can obviously care for more patients at once. So one provider, perhaps a VNA nurse, could perform telemedicine visits through a HIPAA-compliant video chat to multiple residents in the same day and save any of that windshield time and save any of the going to patients' homes. And of course, that the patient home visits, of course, is a necessity as well. And that doesn't have to be a nursing staff, though. That could be a non-medical caregiver or a companion service provider. And then again, that goes to the cost savings. So with that, I think I will go ahead and say, I have heard so many wonderful things from Dr. Bill Thomas and Laurie Orlov and Ryan about what's happening in this industry, where the thriving is happening, what is the longevity market, who is paying for these things, and where are we going next. And if we're talking about AI, I think that there is a huge opportunity for AI in this industry, and we're already seeing Alexa, of course, as Laurie mentioned, in a lot of senior housing communities. We'll see reimbursements for providers and caregivers. CMS has already issued a few codes that reimburse for telehealth and telemedicine. We'll see interoperability, where everybody sort of starts to work together with the same being able to integrate together in a seamless way so that it's completely patient-centered. People don't have to log into multiple places. And then, of course, these naturally occurring retirement communities, it's going to become where seniors age in their neighborhood and services are actually brought to them instead of them having to go out and get those services. And of course, with the coronavirus and all sorts of things like that, I think we can all agree that we would rather have it where someone who is very, very sick is kept home and not come into a community where they can spread infection and then, of course, catch other things as well. So thank you so much. And with that, I will end my portion of the chat today. Again, I apologize for any of the technical problems. I know we had some audio issues, and people have said that they got kicked off a little bit. So I apologize for that, but we are very proud to say that we have had over 200 attendees today for our webinar. Thank you so much for joining us. This is a webinar brought to you by GrandCare Systems, and we will be continuing to host webinars in the future. If you have any ideas of webinars that you would like to see, informational webinars that you would like to be on or see performed, please reach out to us, sales@grandcare.com. We do have this recorded today, and we do have copies of the PowerPoint, so we're happy to provide those to you. Again, reach out to us at sales@grandcare.com. Special thanks to Ryan, Laurie, and Bill. Thank you so much for speaking on our webinar today, and have a great weekend, everyone.